Hi, I'm Dr. Samara Shahani and I'm a GP in London, and I'm going to walk you through how to collect your blood sample while Seth demonstrates each step. Please feel free to stop this video as we go so that you can follow along. You should always read the paper instructions in your kit too. Preparation is key. Before starting, make sure that you follow these steps. Give yourself about 30 minutes to prepare. Get set up and collect your sample, especially if this is your first time. Unlike some other blood tests, you don't need to fast and you can do this test at any time of day. Just don't do your test or post your test on a Saturday, as it might sit in the post for too long. Any other day is fine. You need to drink a lot of water the day before you do the test and on the day of the test. So aim for a minimum of 6 to 8 glasses the day before and at least 2 glasses 30 minutes before your test. This will make a really big difference as to how easy it is to collect your sample. If you haven't followed this step, please don't try to do this test today. To get your blood pumping, we recommend doing some movements like jumping jacks, skipping on the spot, or swinging your arms and clenching and releasing your hands, or whatever you feel able to do for a minute. Please ignore this step if you do not feel that it is safe for you to do so. Wash your hands with soap and water for 20 seconds. Check that your test is addressed for you before starting. This is especially important if other members of your household are also having the test done. Lay your kit out on a low table and get familiar with the components. Your hand has to be below your heart at all times to maintain the blood flow. Using a low table also makes it easier to angle the blood into the tube. If your hand is not below your heart and your arm is not outstretched, your blood won't flow as easily. Don't forget to stay standing for the whole process. If you live with someone, ask for their help while you collect your sample. If you feel faint at any point, sit down. Your kit may include lancets or tubes that are different from the ones shown in the video. Please don't worry, they all serve the same purpose. Always check the paper instruction in your kit to confirm which lancets you have. Grab a clean tissue, then fill a large jug or bowl, or even your sink, with warm water. The water should be the temperature of bath water. Twist the cap off the tube and stand the tube upright using the slot in the top of the cardboard box. Prepare the plaster so that it's ready to pop on your finger. Start by putting your whole non-dominant hand into the warm water. You want your whole hand to be submerged, not just your fingertips. Soak your whole hand for at least 2 minutes so that it gets nice and warm. Some people might like to start with a shower and then warm their hand, but it depends on how much time you have. Once your hand is nice and warm, take it out of the water and dry it with a clean tissue or a clean towel. Start by cleaning your finger with the alcohol wipe. We recommend using the ring finger as your blood flow tends to be the best in this finger. But some people prefer to use their little finger. Try whichever you're comfortable with or whatever has worked for you before. Now get a lancet. If you have a lancet with a white body and purple button and tip, remove the protective tip at the bottom of the lancet. Twist the tip 1 full turn and then pull it all the way out. If you have a lancet with a blue and white body and a blue cap, twist off the lancet top. Place your hand face up on a hard surface like a tabletop so the lancet can work properly. Also, if you are nervous of needles, you won't see any needle before or after using the lancet. But if you don't like using the lancet, you can always get a friend or a family member to do this for you. Press the lancet down on the outer centre of your fingertip. This part is less sensitive and it's easier to direct your blood. If you have a lancet with a white body and purple button and tip, press down firmly on the purple button until you hear a click. If you have a lancet with a blue and white body and blue cap, Press the lancet firmly down on your finger until you hear a click. You can only use each lancet once. Firmly wipe away the first drop of blood with a clean tissue. Massage your hand from the top to just before the piercing in a downward motion. Don't squeeze too hard or get too close to the piercing, or you might damage the sample. Wait 3 to 4 seconds between each massage so there is enough blood to massage out. Tap the drops of blood against the top of the tube to help guide it in. If your blood flow starts to slow down at all, you can wipe the tip of your finger with a tissue. This can help your blood to start flowing again. But if it's taking more than 2 minutes to fill a tube, it's better to start from the beginning. Rewarm your hand and do some more light exercise. Then prick the corner of a new finger with a new lancet. If you have a tube that has a 600 line, you should fill the tube to the 600 line. If you only fill to the 400 line, that's okay. When you have got enough blood, immediately place the cap onto the tube. Push the cap on firmly. Make sure that you push it until it clicks. Slowly and gently turn the tube upside down at least 10 times. Make sure not to shake it. Do not worry if the blood solidifies when it's mixed. This is supposed to happen. Apply pressure on your finger to stop the bleeding. Clean with a cleaning wipe and apply a plaster. Make sure you clean up any blood spills immediately and disinfect the surrounding area. Okay, last bit. Peel your tube label from the returns form and wrap it around the tube. Make sure the printed code is visible. Fill in the date and time on your return form. Get the clear plastic bag labelled 95 kPa specimen transport. Put the tube and lancet through the slot found in between the yellow sticker. Ensure the upper part of the bag remains flat. Pre-fold the flap at the top of the bag down. There is a natural fold line. Remove the yellow sticker and fold the flap onto the sticky backing. Seal well, pressing from the centre and working your way outwards. Put the sealed plastic bag and your completed return form into the cardboard box it arrived in and close the box. Pop the box into the prepaid mailer. Post your sample in a priority post box. They are labelled with the NHS logo. You can find your nearest priority post box using the link www.royalmail.com/services-near-you. These are collected from most frequently. If you are not able to safely get to a priority post box, use your local post box. Do not go to a post office to post your sample. Dispose safely of all equipment. You should get your results in the next 3 to 7 days. They are usually sent by text or email. That's it. Thank you for following along. If you weren't able to collect enough blood or you have any other questions, go to www.gov.uk/taking-antibody-blood-sample.